Hello, this is Dr. Hall. Let's start by reviewing the skeletal system. And about the skeletal system, the bones of the skeletal system support soft tissue, protect internal organs, act as an important source of nutrients and blood constituents, and serve as a rigid levers for movements. The six functions of the skeletal system include support for the body protection, helping to assist with movement, mineral storage such as calcium, red blood cell production, and lipid storage. The structure of the bone can be explained using a typical bone such as the humerus, the long bone of the arm. The main portion of the long bone or shaft is called the diaphysis. The ends of the bone are called the epiphysis. The epiphysis is covered by articular cartilage. Cartilage is a resilient, semi-rigid form of connective tissue that reduce friction and absorb some of the shock in sineval joints. The region of mature bone, where the diaphysis joins the epiphysis, is called the metaphysis. Diaphysis and epiphysis met. In mature bone, the metaphysis include the epiphyseal plate, also called the growth plate. The medullary cavity is the space inside of the diaphysis. This space can contain red and yellow bone marrow, lining the marrow cavity in the endoscope, which contains cells necessary for the bone development. The periosteum is a membrane covering the surface of the bone except for the articular surface. The periosteum is composed of two layers, one outer fibrous layer and the inner a highly vascular layer that contains cells for creation of new bones. The periosteum serves as a point of attachment for ligaments and tendons and is critical for bone growth, repair, and nutrition. In this picture in here, there are the two primary divisions of bone. One is cortical or compact bone. This is the external cover with tightly packed stones. The second is trabecular or spongy bone. This is the less dense inside layer of the bone and the layer that has a lattice called trabecula, which provides strength. There's excellent blood supply in trabecular sponge bone compared to cortical compact bone. And about numbers, we have that the skeletal system is made up of a total of 206 bones and can be separated in two regions: the axial skeleton, which is comprised of the skull, spine, sternum, and ribs, and the accountability is about 80 bones. The other region is the appendicular skeleton, which is comprised of the arms and legs and accounts for 126 bones. About classification, bones can be classified into one of 5 categories. First one, we have long bones, function as little levers for movements. Some examples of long bones found throughout the body include the femur or the tibia and fibula and the leg, the humerus and the arm, and the ulna or radius of the forearm. The other classification is short bones. These bones provide strength, support, and help with mobility of joints. Some examples of short bones found throughout the body include the carpals of the hands and the torso or of the feet. Now we move to the flat bones. The flat help provide protection. Some example of the flat bones includes the ribs, the sternum of the torso, and the skull of the head. The next classification is are the irregular bones. These help provide support throughout the body, as well as a platform for muscle attachment. An example of irregular bones is the vertebra and the spinal column. We have another classification are the sesamoid bones. These bones help decrease friction and increase pulling force. An example of assessment bone found throughout the body includes the patella or the kneecap. And about bone diseases, we must tell that bone mineral diseases of the skeleton include osteopenia and osteoporosis. Osteopenia is the beginning stage of the degradation of the bone mineral density. The bone begins to become brittle and decrease blood supply to the bone. And the osteoporosis is a larger state with a low bone mineral density and is commonly seen in females or who are postmenopausal, persons with anorexia, as well as athletes who must to maintain body weight for competition, for example. About the American College of Sport Medicine guidelines, trainings to increase bone mineral density include perform multi-joint exercise to directly load particular region of the skeleton, and the loading should have a moderate to high numbers of repetition, about 10 or less, and the activities should include exercise with high ground reaction force, and the rest intervals should accommodate the greater load and be somewhere between 2 and 3 minutes or longer, depending of how the individual recover. But this was the skeletal system.